Usually when you talk about getting a medical diagnosis, there's this fundamental expectation of absolute precision, like engineering level
Oh, yeah,
precision, right?
absolutely. It's supposed to be black and white.
Exactly. Like if you fall and break your arm, the whole process is incredibly straightforward. You get an X-ray, it shows this jagged white line on a black background, and the doctor just points right to it.
Right. It's either broken or it's not.
Yeah, it's a clean, highly visible, perfectly categorized reality. And this is what we're getting into today. If you step into the world of modern digital medicine right now, specifically how your doctor is interacting with artificial intelligence behind closed doors, that clean binary X-ray machine is completely shattered.
Oh, it is. I mean, we are looking at a landscape that is just incredibly murky. It is the absolute definition of diagnostic muddy waters right now.
Yeah, and we are currently watching an entire industry attempt to build the boat while they are already trying to navigate these massive, unpredictable waves.
That's a great way to put it, honestly.
Which brings us to the actual reality we are exploring in today's deep dive. We're pulling insights from a recent financial Q&A, and this was held by one of the largest digital networks for healthcare professionals.
Right. So this isn't just some, theoretical white paper about the future of medicine.
No, not at all. This is the actual day-to-day platform where hundreds of thousands of doctors do their clinical work every single day. So our mission here is to understand how the so-called Wild West of AI is actively rewiring the multi-billion-dollar pharmaceutical marketing machine.
And it really is a rewiring from the ground up.
It is. We need to look at how it's altering the literal minute-by-minute workflows of your doctors and, why the massive tsunami of cash flooding into this space is suddenly hitting some very human, heavily regulated roadblocks.
To really grasp the scale of this, I think we have to start by looking at where the money is actually originating.
Yeah.
Because the prevailing narrative out there is that AI is just this experimental buzzword, right? Like companies are just casually testing it out.
Right, like it's a side project for the IT department.
Exactly. But the reality on the ground is entirely different. Some of the top 20 pharmaceutical companies in the world have actually implemented these top-down mandates where 10 to 20% of their entire marketing budgets absolutely must be spent on AI initiatives.
Wait, 10 to 20% of the whole marketing budget?
Yes, mandated from the very top.
I mean, I look at a mandate like that and I just see corporate FOMO, fear of missing out, codified directly into a paycheck. Because if I'm understanding the sources right, the compensation plans and the year-end bonuses for these pharma executives are now directly tied to whether or not they hit this AI spending quota.
You're exactly right. They don't just want to spend this money. They are contractually obligated to.
Yeah.
And just think about the kind of behavior that structural pressure drives.
It gotta be chaos.
It really is.
Yeah.
When the board of directors says, hey, 20% of your budget goes to this specific tech, executives are no longer asking if they should use it. They're just asking how fast they can deploy those funds.
Right, just get the money out the door.
Basically. And the reason the boards are pushing this so aggressively is that pharma companies are just desperate for the specific kind of behavioral insights that only an algorithmic search tool can provide. They want to expose the hidden gaps in their own product marketing.
Okay, let me test that logic for a second, because historically, pharmaceutical marketing was incredibly analog, right? I mean, it was literally a sales rep in a suit bringing sandwiches to a clinic, just hoping to get 5 minutes of a doctor's time to pitch a new drug.
The classic sandwich drop, yeah.
Exactly. So if they are looking for gaps now, I'm assuming it means they want to stop guessing what a doctor needs to know and instead just watch what the doctor is actively typing into a search bar.
That is the exact mechanism that flips the entire marketing model upside down. Instead of blindly broadcasting a message and just, hoping it lands, pharma companies get a real-time aggregated feed of the specific medical questions doctors are actively struggling to answer.
Oh, wow. So they get a front row seat to the doctor's thought process.
Yes, exactly. The industry actually refers to this as the magic moment of learning and decision-making. Imagine your doctor sitting in their office, looking at a complex set of symptoms and actively trying to figure out a treatment plan.
Right.
That is the exact millisecond a pharma company wants to inject a highly targeted educational piece of information about their drug.
Okay, but having billions of dollars in mandated budgets is one thing. Actually getting a doctor to use the tool is the real bottleneck here, right?
Oh, 100%.
Because if I'm a software developer and I know that much pharma money is just sitting there waiting for me to build an AI tool, my immediate temptation is to build a giant digital billboard and just disguise it as a medical assistant.
Which is what a lot of people tried to do.
Right. But the platform we're looking at took the exact opposite approach. They acquired their AI technology and then spent a full calendar year focusing purely on the physician's experience. Like, no pharmaceutical integrations, no banner ads, no pop-ups, just building a sterile, highly functional tool for the doctor.
And that strategic patience is what ultimately built the audience. And the sheer scale of that audience is just staggering. We are currently looking at 800,000 quarterly active prescribers using this platform's workflow tools.
800,000.
Yeah, that is a 30% year-over-year jump, and their overall engagement has grown 50% just since fiscal year 24.
To put that scale into perspective, there was this anecdote in the sources about their telehealth service that really painted a picture for me. So during a major East Coast snowstorm, they handled 720,000 individual patients in a single day.
It's hard to even wrap your head around that number.
It really is. Just visualize the logistics of that. That is the population of a major American city suddenly logging onto a single digital network to see a doctor within a 24-hour window just because the roads are iced over.
The infrastructure required to handle that traffic is immense.
Totally. But here is where I get a little nervous as a patient. If my doctor is adopting a new AI assistant that quickly, my immediate thought just goes straight to the hallucination problem.
Right, the tendency for an AI to just confidently invent facts out of thin air.
Precisely.
Yeah.
Like, if you've ever used a commercial AI tool to summarize a book, you know it might just invent a fake chapter that sounds highly plausible.
Right, and it says it with such authority.
Yes, which is amusing when you're just messing around online. But if a doctor hits refresh and the AI gives them a completely different fabricated answer about a drug dosage, that is terrifying. A medical license and a human life are literally on the line.
And the medical community is acutely aware of those stakes. I mean, there was a survey of 3,000 physicians that revealed that for 71% of doctors who have used AI, accuracy is their absolute #1 concern.
As it should be. So how do you fix that?
Well, the way this platform solved that fear wasn't by trying to build a better open-ended language model. They essentially walled off the AI and forced it to operate within a highly restricted clinical environment.
So basically, instead of letting the AI scrape random health blogs or Wikipedia pages on the open internet, they put it on a strict diet of verified medical literature.
Exactly. They integrated a built-in, trusted drug reference database directly into the AI's core logic, alongside peer-reviewed work from over 10,000 cited authors.
So the algorithm isn't generating creative responses, right? It's aggressively and instantaneously cross-referencing user queries against a closed ecosystem of verified data.
Which explains how they're achieving such high-performance metrics. Because the data shows their medical AI is currently winning 2-to-1 in head-to-head accuracy studies against human medical
But in
residents.
2-to-1, it's wild. It is wild, but if you break down the mechanics of how that's even possible, it actually makes sense. I mean, a human resident is often exhausted. They're working a 24-hour shift, trying to manually recall a specific drug interaction from a textbook they read, like 2 years ago.
Oh, for sure. Cognitive fatigue is a real thing.
Right. Meanwhile, the AI is instantaneously cross-referencing a vast up-to-the-second database without ever getting tired or needing a coffee break.
And that speed and reliability really solve the individual doctor's hesitation. But it doesn't solve the broader institutional panic.
Oh, you mean the hospitals themselves?
Yeah. When hospital administrators look at generative AI, they don't just see a helpful tool. They see a massive compliance nightmare. The fear centers entirely around HIPAA, the strict federal laws governing patient privacy.
Right, because if a doctor copies and pastes my complex symptoms into an open-source chatbot, they might inadvertently be handing over my protected health information to a tech giant's server farm.
And it happens constantly in unsecure environments. The platform actually found that half of all the queries doctors ask the AI contain some amount of protected patient information.
Wow, half of them.
Yeah, half. A doctor might paste a lab result or a clinical note directly from an electronic health record, and it might still have identifiable markers like a rare condition and age or specific dates of treatment.
That's a huge liability.
It's massive. Consequently, hospital IT and security departments are initiating massive crackdowns. They are actively blocking internal network access to open AI tools just to prevent those data leaks.
Which, bizarrely enough, works out perfectly for a platform that has already built a closed, secure ecosystem. That institutional panic basically acts as an involuntary sales engine for them.
Exactly. It accelerated their enterprise adoption to a degree they hadn't even anticipated. Because the platform is fully IPOL compliant, hospitals are desperate to deploy it. It essentially gives their doctors an approved lockdown sandbox to work in.
So how fast are they growing in the enterprise space?
They landed 140 health systems, including 7 of the top 20 hospitals in the country, in just 2 quarters.
2 quarters.
Yeah, 6 months. To contextualize how fast that is, it took them 2 full years to reach that exact same enterprise footprint with their telehealth product. And that was during the peak of COVID, when hospitals were frantically buying remote care solutions.
Okay, so they capture the individual doctors with an accurate tool. They capture the hospitals by solving the privacy nightmare, and now they have this massive captive audience.
And this is where we get into the mechanics of how you actually build a business model on top of this.
Right, because they're creating a brand new multi-billion-dollar market for search advertising. But the way a doctor searches is fundamentally different from how you or I search. Like, if you go to Google, the average search is 2.5 words long. You type best running shoes or pizza near me.
Right, very simple and tense.
Yeah. But the average medical AI search on this professional platform is 23 words long.
Because a 23-word query isn't a simple search. It is a comprehensive clinical narrative.
I picture it like this. A Google search is like rolling down your car window and asking a guy on the corner for quick street directions. A 23-word medical AI search is like walking into a police precinct and handing a detective a highly classified, complex dossier.
That's a perfect analogy.
Let's actually count out what that looks like in practice. So a doctor types, 65-year-old male presenting with acute lower back pain, history of severe hypertension, currently taking lisinopril, allergic to NSAIDs, seeking alternative pain management.
Right, and that's 24 words right there.
Exactly. It contains demographics, current medications, allergies, and the immediate problem, all in one go.
And the depth of that clinical dossier is where the astronomical value lies for pharmaceutical companies. It allows for a level of targeting that makes standard digital advertising look completely archaic.
Because they aren't just bidding on one word anymore.
No, a drug manufacturer doesn't just bid on a single keyword like pain. The sources explain that pharma companies buy what they call conditions. Think of a condition as a complex basket of interconnected keywords that represent that specific 24-word patient profile.
So the algorithm is mathematically matching the narrative the doctor types against the specific baskets of words the pharmaceutical company purchased.
That's exactly how it works. But, and this is fascinating, the most crucial and technically difficult element of this entire monetization strategy isn't the words they want to match. It's the words they are actively paying to avoid.
Oh, right.
They call these suppression words.
Okay, let's construct a hypothetical scenario to illustrate why suppression words are so vital, because the stakes here go way beyond just a wasted marketing budget.
Oh, definitely. It's a safety issue.
Right. So let's say a patient comes in with a severe heart condition, but they also suffer from asthma. A pharmaceutical company makes an incredibly effective asthma medication, but that specific drug has a side effect of causing an elevated heart rate, which, could be fatal for a cardiac patient.
Which happens all the time in medicine, these contraindications.
Exactly. So that pharmaceutical company would spend a fortune to ensure the phrase heart condition is a suppression word in their advertising basket. If the doctor types out that long query and mentions the heart issue, the asthma drug company absolutely does not want their product to appear anywhere near that result.
Because appearing in the wrong context in medicine isn't just an inefficient ad spend. It's a massive liability risk.
Yeah.
And the extreme precision required to build these intricate baskets of keywords and suppression words introduces a significant regulatory speed bump. The industry refers to this as the med-legal process.
I can only imagine. The internal legal teams at these pharmaceutical companies must be incredibly risk-averse.
Oh, they are.
You've got lawyers sitting in conference rooms, combing through massive matrices of words, just trying to anticipate every possible permutation of a 23-word search, all to ensure their drug is never suggested in a dangerous context.
And that creates an unavoidable bottleneck. So even with those top-down executive mandates forcing them to spend 20% of their budget on AI, the actual revenue flowing into the platform from this specific search product is delayed.
Because the lawyers are holding it up.
Right. Unlike older advertising models where a company just shot a quick video and ran it, AI search doesn't require new visual creative assets. But the sheer administrative burden of figuring out the legal targeting means the platform won't see significant revenue realization from this until later in the fiscal year.
I mean, that delay might be frustrating for investors in the short term, but the long-term total addressable market is just massive. The platform looks at what Google did to the Yellow Pages,
Which is a great comparison.
right? The Yellow Pages was a very solid, multi-billion-dollar analog business. Google digitized it, added algorithmic search, and expanded the market size by a factor of 10. The U.S. paid search market for healthcare professionals is currently estimated at around $19 billion.
19 billion.
Yeah. And this platform is betting that by introducing 23-word AI search capabilities, they aren't just going to take a slice of that 19 billion. They are going to exponentially expand the size of the entire pie.
But that massive expansion relies entirely on the assumption that pharmaceutical companies will deploy their budgets freely. And if we pull back from the technology for a second and look at the broader macroeconomic reality, we see a really fascinating disconnect.
Right, because things aren't exactly stable right now.
Exactly. Despite AI being the inevitable future, the platform's overall bookings growth is actually slowing down right now.
Because you cannot separate the technology from the geopolitical climate. The pharmaceutical C-suites are looking at global uncertainty. You've got the war in the Middle East, the volatility around upcoming U.S. elections, fluctuating interest rates. When that happens, their risk appetite just evaporates.
Absolutely. When executives get nervous, they immediately demand optionality. In a booming, stable economy, a pharma company will happily sign a massive 12-month annual contract to lock in their advertising rates.
Sure, lock it in while it's cheap.
Right. But today, they are shifting aggressively away from annual commitments to shorter 3 to 6 month contracts. They want the ability to kill a campaign and pull their money out if the global economy takes a sudden downturn.
Okay, let me play devil's advocate here. If I am running this platform and I know pharma budgets are suddenly tight and my clients are demanding shorter, more flexible contracts, my instinct would be to adapt to their panic.
Which makes sense on paper.
Right. Why not offer a bargain bin option? Spin up some cheaper, lower-tier banner ads, drop the prices, and just sweep up whatever remaining budget the pharma companies are actually willing to part with.
And a lot of competing networks take that exact approach. They pivot to a volume-based model. But what is so fascinating here is this platform's complete refusal to compromise their pricing structure. They absolutely will not offer a bargain bin.
Really, just holding the line.
Holding the line entirely. And their strategy is actually rooted in historical data. During the last major market downturn, they watched pharmaceutical brands experiment with low-cost, discount advertising on other networks.
My guess is those cheap engagements yielded abysmal results. I mean, if you buy cheap digital real estate, you probably aren't reaching the actual doctor. You're reaching a bot or an empty web page.
Exactly. The return on investment just plummeted.
Yeah.
The industry witnessed what they call a flight back to quality. The pharmaceutical companies quickly realized that a cheap ad that no one sees is fundamentally more expensive than a premium ad that actually drives a prescription.
That makes total sense.
So consequently, the platform is actually charging a higher premium for these shorter 3 to 6 month contracts.
Wow. So they are essentially taxing the pharmaceutical companies for their own paranoia.
That is exactly what they're doing.
If you want the flexibility to pull out in 3 months, you have to pay a higher rate for access. And I suppose they can get away with this because they are targeting highly competitive therapeutic categories.
Oh, absolutely.
Let's look at GLP-1 weight loss drugs,
Yeah.
Medications like Ozempic or Wegovy. This is arguably the most fiercely competitive pharmaceutical market on the planet right now. Every single manufacturer is desperately fighting for market share.
It's a gold rush.
It really is. And if you are launching a GLP-1 competitor, you cannot afford to buy cheap banner ads. You have to be in front of the doctor at the exact moment they're deciding which obesity treatment to prescribe.
And the willingness to hold the line on that premium pricing, despite macroeconomic pressure, requires a very specific internal philosophy. The platform actually recently brought on a new chief financial officer who previously helped scale massive networks like LinkedIn and Atlassian.
That's a serious resume.
It is.
Yeah.
And his perspective is crucial because he really understands network effects, this idea that more doctors using the platform makes the AI smarter, which then attracts more pharma money, which in turn funds a better product for the doctors. He attributes their pricing power entirely to a strict physicians-first culture.
He brought up that classic business quote, right? Culture eats strategy for breakfast.
Yes.
And usually, honestly, that is just a motivational poster in a corporate break room.
Yeah.
But here it is the actual engine of their revenue. By refusing to clutter the AI interface with cheap ads but keeping the doctor's query fast, accurate, and pristine, they guarantee those massive engagement numbers.
Precisely.
They are patiently capturing the 800,000 active users, knowing that eventually pharmaceutical companies will have no choice but to pay whatever premium they ask to access that specific audience.
It is a profound long game. We are essentially watching the collection of top-down, mandated corporate AI budgets with the rigorous 23-word clinical reality of a doctor's daily workflow.
And the result of that collision is an entirely new digital economy. It's an economy that is currently moving in slow motion because it's bogged down by global economic fears and incredibly dense legal red tape. But the foundational infrastructure is built, and it is poised to absolutely explode.
It really is just a matter of time.
Yeah. If you have ever typed your own symptoms into Google, you know how wild and overwhelming those results can be. Now imagine your doctor doing that, but with a highly restricted, multi-billion-dollar algorithmic engine guiding their decisions. Whether you are a software developer trying to understand the future of enterprise search, a digital marketer navigating keyword suppression, or just a patient walking into a clinic, understanding how medical information is funded and filtered directly impacts the healthcare ecosystem you rely on every single day.
Because the literal tools physicians use to formulate a diagnosis are being fundamentally redesigned right now by these exact financial forces.
Which leaves us with a final concept for you to mull over. We talked heavily today about the mechanics of suppression words. The fact that pharmaceutical companies are actively paying millions of dollars to suppress their visibility around certain complex 23-word medical queries.
It's a huge part of the business model.
Right. And it makes you wonder if massive corporations can literally buy suppression to ensure they don't appear in specific contexts. What does that mean for the fundamental objectivity of AI in professional fields? As artificial intelligence becomes our primary research assistant, not just in medicine, but in law, finance, and engineering, how much of the intelligence we receive will actually just be silently curated by invisible, multi-billion-dollar suppression budgets? It brings us right back to that initial thought. We all want that clean, simple, binary X-ray. We want the absolute truth. But as AI rewires the system from the inside out, we're all going to have to get very comfortable navigating the muddy waters. That's our deep dive for today. Keep questioning the tools you use, and we'll see you next time.